Doctors of Reddit, what home remedy has a patient try that backfired in the worst way possible? A doctor here. So many stories. Had a young guy who got a venous fracture from his girl riding cowgirl style and he decided to just put an ace wrap on it. He was so worried what he'd see he left the ace wrap on for a few weeks before he came to the hospital because it started leaking pus. When I took it off I could hardly make out the anatomy, it was so distorted, but he had an open hole into the corpus cavernosa. Urology took him to the OR. Edit. Thanks for the awards. My first kind strangers. And for a story about a business. Appropriate. Edit. Lots of questions. Okay, yes, you can fracture the part of the business that holds the blood and gets hard. It needs a repair when this happens and is a surgical emergency, although I think occasionally get fix itself. This guy had a large infected hematoma. No idea what caused the opening in his skin. He went to the OR and got debrided. No idea if he can still have sex. It's not something they put in charts. On the this was gross spectrum of my job I give this a 7/10. Oh, I got 2. 1. Woman walks in the air with a small bite wound on her hand. Said her cat bit her whilst she was putting her feeding bowl in front of her. We told her that we need to excise the wound and clean it because an animal bite can easily get infected. Woman goes berserk, starts shouting at us that she has 20 cats at home, that she knows them well, okay, and that she'll just treat it with honey because what do we know about animals and animal bites? Long story short, she's being brought back in the air almost a week later in a septic shock and hand necrosis too. This one is sad. If you're a bit emotional, please do not read. Woman comes with a 5-year-old daughter in the air because she had severe abdominal pain and is constantly vomiting. Apparently the girl had these intense pain for over 8 days. We do blood works, ultrasound, and it's clearly a very swollen appendix which was about to burst. We tell the mother that we should prep for surgery. Then the mother starts asking about alternative therapy. At this moment I thought maybe she wants to try IV antibiotics and watchful waiting at the station. Not much sense according to her blood results and ultrasound. To which I explain that normally at those values, it always ends up with surgery. And the sooner we operate, the better the outcome. She then starts ranting about crystals and Vinegar and nuts. Then I realized what kind of alternatives she was talking about. Because there was no perforation of the appendix, we didn't have a legal right to take the decision away from the mother. So she took her daughter, snatched the fourth out of her vein, and went out. We informed the police about this possible child endangerment, but 3 days later we get the girl again in the air with the father. Apparently he wasn't home for a long time, and when he got back again and saw what happened, took the kid straight to us. Sadly the appendix burst quite a time before she got to us again, and she was already comatose. I'm not a doctor, but I was a first-hand witness to this whole episode. A family member had sudden onset back pain, severe back pain. So what did they do? Why, go to the chiropractor, of course. They started going to the chiropractor once a week to fix the pain. This went on for about a year. Then they woke up being completely unable to move their back without excruciating pain. We call an ambulance, they go to the ER, get diagnosed with a severe herniated disc in their back, and a small fracture to their right scapula. They prescribed pain meds and physical therapy. But no, they didn't want to do physical therapy, they wanted to go back to their chiropractor. At that point everyone in the family, and I mean everyone, grandparents, aunts, uncles, cousins, etc., started pressuring them to go to physical therapy. Eventually they decided to go just to shut everyone up. Long story short, they spent a couple months doing PT and they've never needed another adjustment again. Moral of the story is, talk to your doctor about back pain and go to physical therapy when they say you need it. I'm a genetic counselor and not a doctor, but was meeting with a patient about genetic testing related to her triple negative breast cancer, often an aggressive form and more likely to be due to mutation in the BRCA1 gene. She had brought a friend along to the appointment. As I remember, the appointment generally was pretty normal. At the end I'm filling out some paperwork, patient goes to the restroom and friend stays in the room chatting. Suddenly she says, I'm just so proud of her for how she's handling all of this. She did all of this research and found online a way to treat her cancer with vitamins and herbs. It's been so good for her. It took everything in me not to tell her off. But hey, I'm not a doctor and it's not my place, plus wouldn't have done any good anyway. When the patient came back I said something about please talk to your doctor about all medications and treatments you're pursuing. This type of cancer is not something to mess around with. But I can't say much more, because I'm not a doctor, and not an oncologist. I had a patient put dry ice on his leg, because it was hurting. It was hurting due to lack of blood flow, and basically he performed a medical amputation with the ice. Another one that I vividly remember from my intern year had a boil on the back of his neck, infected hair follicle or something. Instead of seeing an MD and taking antibiotics, he concocted an ointment that he then continued to put on that area for a prolonged time. It got so bad he basically had a horseshoe abscess starting on the back of his neck and going down both sides of his neck. We drained as much as we could in the oar and did whatever we could at dressing changes, but it was understandably painful. Somehow that was my fault personally. He told me I need to educate myself on how to treat him better. That was in the beginning of me being a doctor in US and I didn't know the fake politeness. Yet so I told him, if he came to the doctor instead of mauling himself we wouldn't be in this position. My mom has a story from 1990s China. She was a resident in her emergency room. A man came in with a jar attached to his stomach. Apparently he had tried to do cupping on his stomach, and the suction had just sucked a bunch of intestines in instead. Cupping should only be done on muscle groups by professionals, never anywhere abdominal. Editing as I didn't make many things clear in my comment, adding that visually it would have looked like a huge hernia inside a jar. The man's skin was not broken, so you couldn't see visible intestines. My mom and her colleagues ended up having to remove many feet of dead bowel and he lived after that, but obviously then would have suffered lifelong issues. I have never had cupping done on myself, and honestly don't know much about it beyond that. If you do choose to get it done it should be by a professional like any other sort of physical treatment. The man had used a jar, like a big jam jar, rather than a small sphere, which is what a normal cupping jar would look like. Sorry for the confusion and lack of clarification everyone. This isn't one guy, kind of like a repeating thing every now and then. Sometimes people get cancer and, for whatever reason, fear/not wanting to accept life/etc, they go about with these nonsense therapies. Eventually they start getting really sick. The lucky one have time and can try actual treatment. But it's already happened to me, in only a semi-short time, that people sort of miss the window and the cancer is more or less terminal or at least really out of control. And to a bit of a tangent, but similar, a lot of people also treat their body like crap for years. Then when they are old, they might need something that is fairly severe, usually surgery, but it can be something else like intense physical therapy, but they are just too out of shape and beat up that they can't handle it, and all they can do is start an accelerated spiral down. So I'm not a doctor, but I'm a high school teacher, and a student of mine very honestly said when discussing STDs that's why, even though I don't use condoms, I drink a capful of bleach before, and a capful after I smash. Another student chimed in, nah man, you need to stick your dick in it. When I tried to explain to them that neither of those are safe, and they definitely will not work, they just laughed at me, like I had no clue what I was talking about. Edit. A lot of people are responding with things like they were joking. I said the second kid was possibly making fun of the first, but the first kid absolutely not. Here are other things he said during that year. I don't know if any of you heard some of these, and some might be New York specific, but he also believed things like tropical fantasy, a type of soda, made only black men sterile, and that's why they only sell it in the hood, and it's so cheap that drinking bleach can cause a drug test to be negative at, if she rides me and I finish in her, she can't get pregnant. Because it just comes back out that if you roll in white paper you get cancer, so only roll in brown paper. Also, that only cigarettes like Marlboro cause cancer, not Newport. When I elaborated based on the white rolling paper fact, he said nah, rolling paper is different than Newport paper, and these are just off the top of my head, and I taught him easily 12 years ago, possibly more. And I'm telling you he wasn't kidding, because I've heard various forms of a lot of this from other students. I've been at the job 22 years, trust me, this isn't new. Not sure if this counts as a home remedy, but med student here. Was rotating in the ER. Guy comes into the ER for mental health concerns. He didn't really specify what concerns at first, but mental health is taken very seriously for good reasons. Somehow, this guy goes into the ER bathroom and cuts his penis off. Because he felt guilty about masturbating. He did not want medications for depression or anxiety. He did not want to talk to a spiritual counselor. I don't know if he even had a religion, but I'm assuming he did, because he stated that he felt guilty for masturbating. He did not want to go to therapy with his wife. Yes, he had a wife, and she stated that their marriage was happy and sexually active. His solution was to cut off his penis. And he stated that the hospital was the best place to do it, because we were there to help stop the bleeding. Needless to say, his plan did not go accordingly, because the physicians determined that the patient was not capable of making sound and mindful decisions. C. Cut off his own penis. Thus, in medical ethics, beneficence trumps patient autonomy in this situation. He ended up having a surgery to reattach his genitalia. Moral of story: please do not cut off your penis to resolve emotional pain/trauma. Mental health related to sexuality, or to trauma, or to self-imposed guilt is real, and is serious, and should be treated. Just please seek help from a medical professional. Don't try to resolve it with your own methods. My favorite was a man who heard that honey lemon tea could help sore throats. He had a sore throat from his constant coughing, which was from his GERD, acid reflux. He lived in a facility where food was included in his stay, so he didn't have honey lemon tea. He didn't have honey, but he did have lemon slices. So he was eating lemons with every meal. Shockingly, it did not help his acid reflux problems. Oh man. Or the guy who was drinking baking soda dissolved in water to cure his prostate cancer. He ended up calcifying parts of his bowels, which had to be surgically removed. He still had prostate cancer though. Apparently this home remedy used to be pretty common, at least until the guy who popularized it died of his cured prostate cancer. Okay, wait, this one is an honorable mention. Technically he sought care for treatment, but it wasn't from a medical doctor. A gentleman got baby stem cell infusions from a chiropractor for $15,000 to treat his arthritis. It isn't clear what happened after that, but by the time I saw him 2 weeks later he was partially paralyzed. I have no idea what was in the infusions, but you couldn't pay me $15,000 to get one. Here's a light-hearted opposite tale, relayed to me by a nurse and caregiver. We'll start with the actual medicine. The nurse worked in a hospital and took care of elderly patients. One geriatric woman was brought into the facility and had to remain there. The exact condition she had is unknown to me, but it caused her strong pain in limbs and joints. Predictably, painkillers are administered. Let her have a few pills. It doesn't help. The old woman still complains. She's suffering and in pain. The dosage is increased. To no avail. Her wailing does not cease, despite receiving a rather high amount of the good stuff. Examining her behavior, it is noticed that this elder is in fact not in dire pain. Her movements are without the strain she would usually endure. So, trickery is called for. The nurse mixes up an awful concoction of salt, vinegar, some bitter, vaguely medicine-y substance, and gives the old woman a hefty spoonful of it. She scrunches up, but takes it. Nurse assures the patient that the worse the medicine, the better its effect. Miraculously, the pain fades within the hour. Wondrous. Inpatient speech language pathologist here, work with strokes, head and neck cancer, ECT, was consulted to evaluate a patient to see if they were ready to start eating by mouth again. This guy was a self-described puller. He had wide coat anxiety and distrust of MDs and never went to the dentist, so whenever he'd get a toothache, he'd grab pliers and extract the tooth himself. Well, one tooth would not come out. Eventually family convinces him to go to hospital because of swelling and pain. He had oral cancer with such bone invasion that the tooth was locked in. Had to have very intense surgery involving reconstruction of his mouth using part of his fibula and skin from his arm. Unfortunately, hair likes dark/moist conditions to grow, so it's not uncommon to see intense hair growth on the skin. Flap that now forms the floor of the inside of the mouth. Won't ever forget that guy. vet tech / nursing student here. The amount of lemongrass / peppermint oils and garlic that people put on their pets or force their pets to ingest is way too damned high. These things are often toxic to pets. They don't kill anything when it comes to parasites or fleas. I don't know how many times I've been like, see that? Flea infestation, or see that? Those are roundworms, with people torturing their pets with various concoctions that have no effect whatsoever and deleterious result. Many people apply these oils and such topically, causing terrible allergic reactions and skin infections. Then fight you that reality isn't reality. I would fully expect a pet owner to someday tell me that they just think happy thoughts real hard to protect their pet from parasites that have evolved to live through faking everything for thousands of years. I can't wait to start working in the human edition. /s. Dentist here had an older male patient that loved his Cajun water filter and loved his water flosser. He wanted to really kill the bacteria in his mouth, so he used the acidic setting on the filter to create a low pH water he'd run through his water flosser to irrigate between his teeth. Acid in teeth. Within just 3 months he'd gone from relatively healthy teeth for a man his age to having eroded away, similar to a gimmick, only more extensive, nearly 50% of the tooth between at least 50% of his teeth. It was nearly non-restorable without a major overhaul, having a questionable prognosis. He refused to believe that could be the case and continued to use the machine, even after we advised him not to do so. I don't understand Cajun's claims or even know if the machine can really create an acidic pH water without some other iron involved. I do know that this man claimed no other dietary or drug changes, and his teeth were nearly destroyed in just 3 months by the water the filter produced. Paramedic, not a doctor. I was in the ed and saw a lot of doctors/nurses crowding around an x-ray. A 40-50s man slipped while using a chainsaw and struck his knee, causing a large laceration, but no actual damage to bones/ligaments/tendons. Patient then proceeded to get his nail gun and fire 4 nails across the wound to staple it shut. The general surgeon on hand was actually quite impressed, commenting that he somehow still didn't strike his bones, ECT, and did quite a good job, considering. 30-ish man, fentanyl overdose. Found cyanotic by his girlfriend, who raised the alarm. When we arrived, the patient's father-in-law had cleared space in the living room, so we could have good access. Furniture to walls, had patient in recovery position, and was holding airway patent. All of this fantastic, but then also told us he's treated the opiate overdose with 2 points of meth, 0.2 g, which he had administered forth. We oxygenated and had police walking in the door behind us soon after, and when we went to Narcan, very quick and effective treatment for opiate overdose. We had everyone ready and staged to deal with potential violence/unpredictability from a meth-affected patient. Surprisingly, he was actually very calm and compliant afterwards, and came to hospital without much issue. The usual I'm not a doctor, but a family member. Joe is a physician's assistant in an urban area. He sees a lot. This one stuck with me. A family of 7, mom, dad, 5 kids, all came in with intestinal distress. They were all sick, in pain, and had stuff coming out of both ends. At first, Joe thought it was some kind of gastrovirus, but then he started talking to them. Ended up that a couple of the kids felt sick and threw up a couple of times. The parents decided it was a good idea for all of them to eat Tide Pods to kill the germs inside. Yeah, I can't really figure out that leap of logic either. So they all ate Tide Pods, which did actually make them sick, and made the 2 kids who were sick initially even sicker. Sigh. Some people should not be allowed to reproduce. Joe treated them with total respect while they were in the but you'd better believe they all laughed their ass off after the family left the Most doctors over their careers will see some of the absolute most ridiculous things that people do based on hearsay. There was trend back in the 80s where someone on TV was hawking magnets that you'd tape to various areas of your body to help with medical problems. Not too different than what Copper Fit does nowadays, with claims that copper applied to the outside of your body heals things deep inside. Lol. Anyway, I'd see patients who'd stop all their meds, even things like their blood thinners, and then tape magnets over their heart, arteries, etc. I would try to demonstrate to them that if you hold a magnet only 1/4 inch from the refrigerator, it will drop to the floor because the effect is minimal at any distance more than 1/4 inch away. Still, they would fall for the scam and a bunch of their arteries would clog up, strokes, heart attacks, etc., cause they had allowed themselves to be duped by ridiculous quack claims. I diagnosed my grandmother with pancreatic cancer in June of 2020. I'm the only medical professional in my family, and since I'm just a kid who hasn't entered the job market, yet I don't think anyone took me that seriously. While I was freaking out, my extended family decided that I was being over dramatic and told me that they'd take care of it. My mom and dad took me a little seriously, but even they were like, dude, she just looks a little yellow. How can you say she has pancreatic cancer just from talking to her on FaceTime? But they pushed my aunt and uncle to take her to the hospital anyway. There was a little grumbling, but when they took her, the biopsy was inconclusive, but multiple imaging and pathology studies indicated that I was right. Unfortunately, the lack of concrete biopsy results meant that I once again had to spend months convincing people to push the doctors to do more, all of which was precious time that could have been used to treat my grandma. Anyway, but the time they realized I was kind of right, it was far too late. Got a phone call from my aunt about a camp in the rural south where a godman claimed to be able to cure cancer. By that point I'd kind of had it. Auntie, if the cure for cancer existed, do you really think it'd be sold by a man in a hut and not extremely commercialized by every major pharmaceutical company in the world? Do you really think you found the cure for cancer on Facebook? Anyway, my grandma passed away 8 months ago. Even the week before she died, one of my aunts and my grandpa asked me what she was sick from. I was genuinely stunned by that point and yelled, she has cancer. I've been telling you she has cancer for nearly a year. And then I got yelled at for not behaving professionally and for not having proper bedside manner by my mom, so yay. I had a patient who was pouring hydrogen peroxide on his cellulitis/diabetic foot wound instead of being seen by a doctor. Thankfully his wife dragged him in. It's always wives dragging their husbands in, I swear to God. So we were able to get him the treatment he needed before he started going septic. The saddest things about all of the posts that aren't I don't trust modern medicine, herbs can treat my cancer is, like my patient. A lot of these people probably are trying to do whatever they can to avoid going to the doctor simply because they can't afford it. And now with COVID making the hospitals as overloaded as they are, some people worry they might be in the ER for 8 hours, 12 hours, or potentially even longer, just to be told there's nothing wrong. And sometimes missing work for being sick is just another financial strain on top of their medical bills. I'm not a doctor, but I worked as an innkeeper at a countryside B&B where I once got a strange call, request, and discovery. A woman called from another state and informed me that she'd been trying to get a hold of her elderly father that lived on the adjacent property to the inn. I sort of knew of the guy, an old, 80-ish, grizzled farmer that always fixed and fabricated his own equipment instead of ever buying anything new. He was also one of those Mylanders mine and my shotgun gets shown if you step on it kind of people. So I was apprehensive about going over there for a wellness check. I inform my boss that I'm headed over and to listen for any signs of trouble I might be getting myself into. I hop over his locked cattle gate and walk up to his house, knock, but there is no answer. I look through a side window and see him in his recliner. He moves a bit when I knock and wave, but looks a bit out of sorts. I check another door and it is unlocked. Entering, I announce who I am and who sent me. Coming to the living room, I see that he has an old dried out half plate of food sitting next to him, the TV blasting some random channel, and a blanket over his body. He looks like he's on death's doorstep. I call an ambulance after he doesn't clearly respond and remove the blanket to check if there are any physical signs of what's wrong. Pulling the blanket away, I smell old urine and the sweet putrid smell of infection. Long story short, the daughter informed me, after calling to thank me, that her father pulled out his urethral catheter. It had an inflated end to hold it in place inside and couldn't get it back in. So instead of calling for medical help, he figured he could just insert a length of narrow fuel line from a weed eater to help re-establish the flow. The fuel line was obviously dirty and not meant for interior medical use, so he got a horrible infection and had pretty severe sepsis when I found him. He survived for a couple more years and died of natural causes. Edit fixed I hope over his cattle gate. To I hop over his cattle gate. Not a doctor. I tried to treat an infected tooth for months with salt and oil pulling. It just kept getting worse and worse. Now I didn't believe these stupid home remedies were better than professional care, but I'm American and was very poor. I'm America. Dental care is usually paid out of pocket. Even the teaching dentist would cost over $1K. To pull the tooth point I got a round of antibiotics from a cheap dentist, but they refused to treat me anymore until I fixed my tooth. I cried. I was afraid I was going to die because I was refused what care I could afford. So home remedies were the only option available. I did eventually save enough to get my tooth pulled, and I lived. Don't judge Americans too harshly for these things. Even when insured, going to the doctor or dentist is not guaranteed to be paid for, and these costs can mean you end up homeless or starving. One morning I was called to the emergency room by the head nurse. She directed me to a patient who had refused to describe his problem other than to say that he needed a doctor who took care of men's troubles. The patient, about 40, was pale, febrile, and obviously uncomfortable, and had little to say as he gingerly opened his trousers to expose a bit of angry red and black and blue scrotal skin. After I asked the nurse to leave us, the patient permitted me to remove his trousers, shorts, and 2 or 3 yards of foul-smelling stained gauze wrapped about his scrotum, which was swollen to twice the size of a grapefruit and extremely tender. A jagged zigzag laceration, oozing pus and blood, extended down the left scrotum point amid the matted hair, edematous skin, and various exudates. I saw some half-buried dark linear objects and asked the patient what they were. Several days earlier, he replied, he had injured himself in the machine shop where he worked and had closed the laceration himself with a heavy-duty stapling gun. The dark objects were 1-inch staples of the type used in putting up wallboard. We x-rayed the patient's scrotum to locate the staples, admitted him to the hospital, and gave him tetanus antitoxin, broad-spectrum antibacterial therapy, and hexachlorophene sitz baths prior to surgery the next morning. The procedure consisted of exploration and debridement of the left side of the scrotal pouch. 8 rusty staples were retrieved, and the skin edges were trimmed and freshened. The left testis had been avulsed and was missing. The stump of the spermatic cord was recovered at the inguinal canal, debrided, and the vessels ligated properly, though not much of a hematoma was present. Through and through Penrose drains were sutured loosely inside, and the skin was loosely closed. Convalescence was uneventful, and before his release from the hospital less than a week later, the patient confided the rest of his story to me. An unmarried loner, he usually didn't leave the machine shop at lunchtime with his co-workers. Finding himself alone, he had begun the regular practice of masturbating by holding his penis against the canvas drive belt of a large floor-based piece of running machinery. One day, as he approached orgasm, he lost his concentration and leaned too close to the belt. When his scrotum suddenly became caught between the pulley wheel and the drive belt, he was thrown into the air and landed a few feet away. Unaware that he had lost his left testis, and perhaps too stunned to feel much pain, he stapled the wound closed and resumed work. I can only assume he abandoned this method of self-gratification. Doc in a country with universal health care. Last couple of I've seen people treating cuts requiring stitches with superglue, honey, sugar, Vinegar, and one person actually stitched himself up with fishing wire. Was quite impressed with that, even though it got badly infected, which is why he needed us. Seen people with neglected fractures that were just wrapped in gauze, etc. The one I'll never forget though was a patient I saw during my orthopedics residency. It was a middle-aged woman that was sent in by her GP because she had an x-ray of her foot taken after having swelling, pain and redness for over 6 months, and the massages and organic ointments she was using weren't helping. The x-ray showed signs of bone destruction, so her GP sent her in for further testing. When I saw her, her foot was about twice the size of the other one. She couldn't even put weight on it, and after asking more questions and examining her, it turned out she'd also had a cough for over 3 months and swelling, redness and pain in one of her elbows for a few months. Tried to treat all of it using ointments, steaming and massages, but didn't help a whole lot. Sent her in for pretty much a full body scan. Turns out she had cancer, and it had spread all over the place, including both of her lungs and bones. She still insisted she'd be fine by just using her ointments, but I got her admitted to oncology, where she died before the end of my rotation 2 months later. RN, not MD. Guy limped into Ed complaining of sores on his feet. As he's taking off his socks, he's telling his story. He had athlete's foot, and he tried all the OTC remedies without success. So the next logical step for him was to spray his feet with industrial brake cleaner. Something about how he used it at work sometimes to clean the grease off his hands. So why not try it on his athlete's foot? At this point, he pulls his socks off, along with a goodish amount of foot skin. The chief component of the brake cleaner he was using was hydrofluoric acid, which will burn through your skin and keep going and going and going. Friend didn't know this, so he'd naturally followed it up with rubbing alcohol and hydrogen peroxide when he got home. Then just threw on a new pair of socks and went about his daily bees for 6 days. Then he came to our with his feet falling off. Crazy thing was, he didn't seem too bothered about it. Said it hurt, but not too bad. Anyhow, we wrapped those fakers in calcium impregnated gauze and sent him off to the local level 1 with a burn unit. I wonder what happened to that guy. Moral, slow and steady wins the race. Or something. Former veterinary assistant here. Little old lady bathed her little dog in pine tar shampoo every month. After a while she noticed the dog's skin was red and irritated, so she started bathing the dog every other week. Then every week. She didn't bring her dog to the vet until 2 pine tar shampoo baths per day was getting too much for her. Poor old lady never understood that her choice of shampoo was to blame. Dog had cracked raw red skin all under his fur, and the vet gave the owner a free bottle of medicated dog shampoo after we marinated the little pup in it. Old lady was just like, oh, no, my pine tar shampoo at home works fine, save that for somebody who needs it. And the head vet had to insist she take it for free, with a promise of another free bottle when that one ran out. I remember it all so vividly, because that poor dog gave me my first on-the-job dog bite. Obligatory, not a doctor, but I worked in several medical companies writing software as a senior software engineer. One company was a private healthcare clinic, nationwide, who undertook an effort to digitize and sanitize decades of patient data, anonymously, so that machine learning specialists and data scientists could make sense of it, and I was tasked to build software that would attempt to eventually take over the tasks from doctors' assistants and general practitioners during the triage stage. You won't believe how many people think that prayer is a good attempt at fixing things like STDs, cancers, gangrene, and many other you need to see a doctor type of situations. Of course, essential oils and other placebos were next. We all know placebos can have a positive effect on things, but most definitely not on cancer. That is still treatable, but won't be for long. When testing the system, we had to give the system a way to respond to this sort of feedback from the user. Digital doctor, what have you tried yourself? Patient, I tried to pray for several months and I think God is listening, but the devil is fighting back, not verbatim, but we had hundreds of such types of feedback. Written. The standard response would always be that a professional would take it up from there. But we tried to learn something from that kind of thing. There is just nothing you, medically, can do with that kind of feedback. You don't want to alienate or antagonize the patient. I left about a year before COVID hit the globe. I can't even imagine that kind of feedback they're getting today. Probably something like, patient, so I tried the horse paste and 1000 milligrams of vitamin D, but I keep feeling worse. Patient, I did not wear a mask because they just fester germs inside of them, but I still got sick. Patient, I got the vaccine, but then I got into a car crash and I'm hurting all over and I really want to sue the Bill Gates. Their macro ships must have done this ! 11 patient, my unvaccinated husband died, and the heavens have a new angle now, but I also feel sick and COVID test got back positive. That means it's good, right man? I learned that people are dumb. Really intensely dumb. I had a patient come into accident and emergency with an oblique fracture on his ulna. He took off the bandaging, and what was underneath was putrid. He had fractured his arm 3 weeks before he came into A+E. He had been tying hot chapatis, thick flatbreads, covered in turmeric, ghee, clarified butter, chilies, and ginger on the arm for the last 3 weeks, and was washing his arm in yogurt. He had swelling from the fracture, second-degree burns from chapatis, necrosis of the burn tissue, a fungal infection from the heat, moisture, and random assortment of food, and cellulitis with lots of pus. In addition, his entire arm was stained yellow by the turmeric. He spent 10 days in hospital on 4th antibiotics for the infection, and had to have his ulna set with screws and a plate. His surgery was massively complicated by the fact the fracture had already began to set incorrectly and had to be rebroken and his ulna broken in another area to straighten out the mess and set it correctly. Had he just come in when he had broken it, I'm 99% sure we would have just been able to set it and popped on a cast for 4 to 6 weeks. Hospital doctor in Ireland. Here there is a popular myth that Ivermectin will treat and prevent COVID-19. No evidence to support this. A middle-aged woman presented to our urban hospital a few months ago in a coma after taking too much Ivermectin horse paste, incredibly potent medication for deworming horses, in an attempt to prevent catching COVID-19 from her positive daughter. Patient had declined the vaccine previously. After 2 days of her on the edge of being intubated due to her low level of consciousness, she started to emerge. Thankfully she recovered steadily from the Ivermectin toxicity and was neurologically fine until she spiked a temperature and developed a dry cough. Her COVID test was positive and she was transferred to the COVID ward. That was the last I knew of her. Hopefully she recovered and went home to dissuade her family/friends from ever being so similarly foolish. Interesting fact, if you look up Ivermectin horse paste on Amazon, it has a disclaimer saying it is not safe or effective in preventing or treating COVID in humans. Edit, typos. Not a doctor. When I was 15 I came down with a horrible sore throat and high fever and all of the glands in my neck swelled up. I was in incredible pain and found it hard to speak, swallow anything or even breath, and the fever didn't subside. I begged my mother to take me to see our family doctor, but she insisted on using a home remedy of over-the-counter painkillers and ginger tea. A week and a half in, with the pain getting worse and the fever still there, she reluctantly sent me to the doctor, who quickly sent me to an energy appointment with an EMT. One look down my throat and the EMT recoiled in horror, informing me that I had an extreme case of tonsillitis. Anyone who has had it knows the agony, and because I had not sought treatment, I was at risk of developing a brain or heart infection. I spent the next week at the hospital with 4th antibiotics. Take your kids to the doctor. Not a doctor, but a guy I used to work with was very skeptical of Western medicine. One day he came in and told me that his daughter had been very unwell with stomach pains while at school. The school had rushed her to the hospital to get checked out, but he had since discharged her and taken her home. This went on for months, with his daughter feeling unwell and needing time off school, but he refused to take her to the hospital for more tests, claiming a lot of it must be in her mind and believing that if she prayed more she would be fine. They were a Mormon family. Then one day he came in and told me all would be fine because he had consulted people at his church who told him to give her flat Coca-Cola mixed with salt and turmeric. Long story short, his daughter had intestinal cancer and almost died. The Coca-Cola remedy did not help, in case you're wondering. But I used to do first aid treatment as a medic for a large industrial company. One day an employee came in with a burn to their lower forearm and upper hand that was caused by a faulty cutting torch. It was bad enough that it had blistered all around. I cleaned and wrapped it up and instructed the employee to come see me in the morning of the following day. All was well until around 11 AM when the employee came in. I removed the wrap from his arm and discovered that he had not only popped the blister, but had also peeled all of the skin off the burn. After the initial shock wore off, I asked them why they had done that, and their response was, "My uncle said it would heal quicker." I recleaned it, rebandaged it and gave them instructions on proper care, and asked them to come see me in the morning. The following day they came in, and their arm was now red and swollen. I asked them if they had been following the care instructions given, and they responded with, "Get this, I have been peeing on it after the shower, because my uncle said it will keep infection away." This person had not only popped the blister and peeled away the layer of skin, but had also been urinating on their arm. It took 2 weeks of antibiotics after that to get the infection to clear. Not a doctor, but one time my husband split his chin open. He didn't want to go to the ER for stitches because of the extremely embarrassing reason he split his chin. So we went to the store for liquid bandage. Couldn't find any, so he got the bright idea to try Superglue. We were smart thought and also bought Superglue remover. He laid on the couch as I punched his chin together and glued it shut. As I went to stand up I couldn't pull my fingers away glued to his face. But it's okay. Superglue remover. But that was across the room on the kitchen table. So he stood up and we walked with my fingers glued to his face. He's a foot taller than me and I grabbed the remover with my free hand. As I was taking the cap off one-handed I dropped the tube. Instinctively bent over quick to grab it, ripping my fingers off his face. To this day he has a big nasty scar on his chin and can't grow hair in the 2 places my fingers were stuck to his chin around it. I later became an EMT and worked in a hospital and knew how dumb we were and never experienced a part that did something dumber than that. Thank goodness. A woman decided to get breast implants. She went big as her meth dealer boyfriend wanted her to, like probably too big, but her plastic surgeon agreed. Her relationship didn't survive the turmoils of meth addiction and she decided she didn't want the huge breasts. She used a safety pin to deflate them, because that makes sense when you're on meth. Came to us a few years later with what looked like half a ream of crumpled paper under the stretched skin of her breasts. We agreed to take out the implants so she could have a better chance of detecting breast cancer in the future. I can't go into details, but it was a difficult surgery to remove the capsule that formed around them. Next, a Western adherent to an Eastern medicine decides he's more knowledgeable than his Western medicine doctors. Takes a bunch of supplements from an Ayurvedic supplement seller. Gets a big case of lead poisoning. And then gets mad when I won't send his supplements out for testing to see which ones he could keep taking. Same guy, feels bloated all the time. Every time he eats he has to burp. Makes a big fuss about burping. Won't try traditional, Western, meds or diagnostics. Won't look at the elimination diet or low FODMAP diet. He gets mad when I can't guess what he ate last based only his aura. He decides to do his own fecal transplant with a buddy of his fesses. Freezes his buddy's pup and swallows it. It wasn't exactly a great plan, but I had to test him for all the hepatitis and infectious diseases. Luckily, he fired me. Still upset that I couldn't read his aura after that. Still burping as far as I know. I'm not a doctor, but I feel like I should tell this story nonetheless. I have a rare genetic disorder called Ehlers-Danlos syndrome. For those unfamiliar, it is a disorder that causes your internal collagen to be mutated and therefore extremely fragile and stretchy. Telltale signs of Ehlers-Danlos syndrome are joint hypermobility, stretchy skin, fragile bones and poor balance, although it encompasses a lot more than just those few things and can sometimes even lead to brain aneurysms and organ prolapse in rare cases. In my case, it has affected my legs drastically over the years. I can't walk longer than the length of my house without crutches. I have broken my ankle before by walking through my kitchen and ruptured my Achilles tendon twice by simply tripping. Needless to say, working a normal 9 to 5 job is extremely difficult for me. I applied for disability benefits a while back, and when you meet with the consulting doctors for said benefits, they do a physical evaluation and a psych eval too. Here's a rough transcript of my eval with the psychologist. Shrink, so. Let me ask you something. Go right ahead. Shrink, if you weighed, let's say 170 pounds, do you think you'd be able to work more? Me, nope. and I have 5 different doctors who I can call right now that will tell you my illness is not weight attributed. Shrink, oh no, I didn't mean anything like that. I was thinking maybe, if you lose a little. Me, the weight of my skeleton itself is too much for my joints and ligaments to steadily handle. So unless you can find a way to make my bones lose weight, being 170 pounds will make no difference. Shrink. Me. Shrink, okay. I think we are done here. The craziest thing about this is that the doctor who did my physical exam didn't say a single word about my weight. Personal experience here. Once I had really bad jock itch. I used to do a lot of highway driving in an old car that was quite hot. My nuts would be a suppy mess by the end of the day. I had used steroid creams before, and the fungus came back as soon as I stopped. So I did some googling and saw that apple cider Vinegar worked for tinea/fungus. Well, Vinegar is Vinegar, right? I decided to splash some white Vinegar on my balls. It worked quite effectively. So effectively that the skin on my sack got super thick and peeled. It was like I had sunburned my scrotum. I gave myself chemical burns. I ultimately solved the problem by using tea tree oil soap and switching to boxers from briefs. I would also drive wearing just boxers and quickly change into pants when I reached my destination. Funny story about that, I was doing that once and I got stopped at drunk driving checkpoint with not pants on. The cop didn't say anything and neither did I was sober. From my friend who's a dermatologist. A woman came in with really bad acne to the point my friend said she thought the woman was coming in about cystic acne. Well, the woman starts to explain that the reason she came in was because her acne had been getting really bad within the last month and she finally decided to come in. So my friend starts asking all the usual questions including, have you changed your skincare routine recently? And the woman explained that she had started using coconut oil because she read that it could help acne. And so my friend asked what kind and the woman then explained the kind you use to cook. My friend had to explain to her that the reason the acne was so bad was because she had basically been coating her face in cooking oil for the past month and that she needed to stop until it cleared up and she needed to find an actual skincare product if she wanted to try coconut oil. My friend said it took several months for that woman's face to clear up. Ooh, I'm definition late into the thread, but my wife had a great one from med school. This is secondhand and from 15 years ago, so the details will be lacking, but she was at the University of Miami, Jackson Memorial Hospital, which serves a diverse population, including many from the Caribbean islands. A Haitian woman, if I remember correctly, came in complaining of the vines in her vagina. They had no idea what she was talking about, but went straight to an examination. Turns out the woman had sometime in the past suffered from a prolapsed uterus, and apparently one island remedy for this was to put a potato in your vagina to hold everything together. Well, she just left it up there for a good while. It started to sprout and grew enough to start invading the surrounding tissue, causing her considerable discomfort. She had the vines. Yikes. I was a corpsman in the Navy and we share a lot of what the fuck stories amongst each other. My friend told me one in particular that will always stay with me. She worked on the ob/gen ward at the hospital and had this one elderly lady as a patient. She had been complaining of abdominal/pelvic pain and was admitted to the ward for further testing. When the doc came in, he started his exam and removed her undies. My friend told me that the stench in there became immediately eye-watering. Doc noticed that there was an irregular greenish vaginal discharge. Going back to his exam, dude found a little sproutling growing out of her. Doc went and used his forceps to pull out a small potato out of her uterus that she apparently forgot about. When asked about it, my friend said she had a wide-eyed look on her face and solemnly said, I have no clue how that got up in there. Apparently, back in the day women used potatoes to prevent getting pregnant. Not a doc but flight paramedic. We picked up a kid about 4 or 5 with burns to the face, chest and arms. Apparently he was helping dad fill the lawnmower with gasoline a couple days ago when it ignited all over the poor kid. They were Amish or Mennonite, I don't recall exactly, but dad said they brought the patient to their healer who applied lettuce leaves to the burns. Needless to say the leaves had to come off. The patient was sedated, intubated, and, well, delettuced by the local emergency department prior to our arrival. I guess it didn't backfire in the worst way possible, but I can't imagine the application and removal of lettuce leaves would benefit the healing process. Last I heard kiddo was doing well. He underwent an experimental treatment that I also can't recall, had skin grafts placed, and got to visit with the hospital's volunteer dog, GI Brigade. So moral of the story, lettuce belongs in your salad, and not on your burns. Family medicine osteopathic physician. So I get people all the time thinking I'm a homeopath that doesn't practice evidence-based medicine. They're wrong. I've got a few stories that come to mind. The saddest is a woman in her 50s with diabetes, A1C of 11.5, wanted to take herbal supplements to treat instead of allowing me to start her on prescription medications that actually work. Her kidney function was already stage 3, and she had worsening neuropathy from uncontrolled diabetes. Even after hitting her over the head with the fact that things were only getting worse, she chose to drive 5.5 hours to Chicago to see an herbalist who gave her some concoction of cinnamon and bullcrap. She had the balls to call me and ask what I thought about what she was taking. 15-minute phone call later I made her cry by telling her the truth. Didn't think I'd see her again. Fast forward a year, she comes back to me with neuropathy that had progressed further. New diagnosis of diabetic retinopathy, kidneys were borderline end stage, and A1C was 13.8. She's now on dialysis and miserable. I'm not a doctor, but this was a remedy I used on myself, which earned me a trip to the ER. I was having problems with either a persistent yeast infection or bacterial vaginosis. My sister, who is one of those crunchy granular hippie types, told me that she found a home remedy online to treat said infection at home, using a tampon that was soaked in peroxide and some other supposedly antibacterial things. I did this several times, at night before bed, over a period of a couple of days. On the third day, I woke up and felt absolutely terrible. I had a fever and chills and was vomiting. I thought I just had the flu or something, so I wasn't super concerned. My partner worked all day, which left me home alone with the baby. I had another bout of vomiting and started to feel absolutely awful, so I walked out into the living room with the intention of lying down on the couch and promptly passed out in the middle of the living room floor. I came to a few minutes later and realized that something was very wrong. Called my mom and sister, and 911. They came to take my baby home with them while I went to the ER. Turns out, I gave myself a pretty good case of toxic shock syndrome and was very lucky to have not sustained any permanent damage. So, be careful what you try as a home remedy on the interwebs, kids, it can literally kill you. Not a doctor, but I worked as a dermatology medical assistant. This guy came in because he had found a skin tag on his business that the internet told him to remove with floss. That didn't work, so he went to the internet again, which told him to use apple cider vinegar. So this man soaks a piece of gauze with vinegar, tapes it to his dick, and then goes to sleep. He awoke to find a large chemical burn on his business. This man goes back to the internet for a third time, and what does the internet tell him to treat this wound with? More apple cider vinegar, which he repeatedly applies to the area. Finally came into our office a few weeks later for this wound that wouldn't heal. When the doctor said she may have to do a biopsy, the guy said he'd have to think about it. Lord have mercy. Not an MD, but work with a lot of them. Funniest NSFW story one of my doctors told me was this. A lady posted on FB group chat asking for home remedy for COVID. One commenter said he has the cure, but he can only DM. So he DM her, and they started talking. He convinced her the cure can only be administered from the tip of his dick. She ignored him. Weeks passed and all her friends and family were getting sick. She refused the vac. She contacted the FB creep and they arranged a meeting. He drove 190 miles to her place. He administered his cure in her ass. She ended up going to the ER later because she needed stitches in her you-know-where. The doctor examined her and did a round of blood test because she mentioned she just had an all-setch. They scheduled to get her sutures and the blood work came back. Everything clear. She even got a COVID test just in case. Doctor asked if she wanted the vax. She still declined and was discharged. She said she'll take her chances. The doctor told me she'll most likely get another cure in her as. Not a doctor, but I'm the dumb one. I was riding one of those rental electric scooters when our city got them. Mind you, I longboard and rollerblade and have good balance. Never rode a scooter though. I get one unlocked and it felt loose, but again never used one and felt it was normal. Not even 10 minutes into our ride, I lose control and fall off and land hands first into the ground. I immediately had pain in my arm, but figured it was just from the fall. It wasn't as bad as you'd figure for a broken bone, so I was like, oh, it has to be sprained from maybe the twist when I fell. Okay, so I explained it to my holistic roommate, and she's like, night tape is my hero with muscle aches and bruises. Yes, it does work. I use it for hockey if I have a sore knee or shoulder. So what the hell? Slap it on my arm, and it should feel okay soon. Wrong. It made it worse. So my coworker is like, let's rip it off, and it should improve. I'll rip the skin off, and then I had these red strips. Didn't help. Eventually went to the the doctor listens to the story, and is like, what the fuck, why? Do you think this is a sprain? And when he saw the red marks from the tape he kinda got angry for not coming sooner. Okay, I don't blame him, but it didn't hurt that bad. Yeah, right, broke right below my elbow. Luckily it healed perfectly with no long-term effects. Not a doctor, but I'd like to save others from what I have done to myself. One day, having a hard time pushing it out, I was at work and had a lot to do, so I pushed a little harder, too hard. All of a sudden I was in searing pain. I had to go to the I couldn't sit, couldn't stand, just pain. After way too long of a wait I was told I had fissures, multiple tears just inside my rectum. The was busy, so I was rushed out. I was not told how to treat it, so I thought, well, I put Neosporin on other cuts, why not this one where that helped with the pain? It did not help the itch, so I decided to use some anti-itch cream as well. Both anti-itch creams and Neosporin will thin your skin, make the itch persist and make you more prone to more tearing. When I told the doctor the itch wasn't going away, she looked at me like I was an idiot after I told her how I was treating it, lol. I'm not a doctor, but this caught my eye on Wikipedia a while ago. Miracle Mineral Supplement, MMS, also promoted as Master Mineral Solution or Chlorine Dioxide Solution or CDS, to evade restrictions by online retail platforms, is a bleach solution that has been fraudulently promoted as a cure-all since 2006. Its main active ingredient is sodium chlorite, which is activated with citric acid to form chlorine dioxide. In an attempt to evade health regulations, its inventor, former Scientologist, Jim Humble, formed the Genesis Second Church of Health and Healing, a fake religion whose sacrament is MMS. During the COVID-19 pandemic, advocates of MMS, such as canon proponent Jordan Sather and Mark Grennan, who are affiliated with the Genesis Second Church, began to suggest this would treat COVID-19. Several sources interpreted remarks by US President Trump in the 23rd of April 2020 briefing as promoting this claim, leading the CDC, scientists, and bleach companies to restate that bleach is harmful to humans and should not be ingested or injected. MSN News quoted Professor Rob Chilcott, a toxicology expert from the University of Hertfordshire, that there is no scientific evidence that injected bleach or disinfectants will affect viral particles, but that injecting bleach would likely result in significant irreversible harm and probably a very unpleasant death. Mandatory, not the doctor, but the patient. My mother told me to treat a yeast infection with Vinegar. So, 3 times a day I'd go to the bathroom, soak a piece of cotton in pure Vinegar and wipe a little bit of pressure to make sure it was getting inside. At first it doesn't feel so bad, but then the burning sensation hits you. It was like I was treating an UTI with the devil's saliva. But what do you know, 4 days later the infection was gone. Next year comes around, and I get an infection again. So of course I waste no time and start the Vinegar treatment again. And here's where it backfires, and the consequences don't hit me, but my father. I was keeping the Vinegar on an empty eye drop bottle on top of my bedside table, and this is important, because me and my father use an allergy med for the nose that has the same type of bottle and I keep it there too. So one day he runs out of his allergy serum and decides to take mine. He picks the first bottle he finds and shoots a moderate jet of 98% alcohol Vinegar on each nostril. We hear a Jesus faking Christ oh my god what the heck, and he runs to the sink. He says his nose, his mouth, his throat, everything burns. It's like he was set on fire inside out 15 minutes later, and he's recomposed enough to ask what the hell was that. I explain and he asks what on God's name is wrong with me. I say mom told me to use the Vinegar. She swears she doesn't remember ever saying such a nonsense as it would literally be torture. Anyways I get screamed at. The irony is that his nose felt weirdly better after that, and 2 days after my infection was gone too. TLDR. 8/10 would use Vinegar on my crotch again. My story is pretty benign. I work in pediatrics, and people get pretty obsessive about their newborn's umbilical stumps, the dried up remnant of umbilical cord left after it's cut. Generally you leave it alone and let it air out, and it eventually falls off, and you're good to go. But this one mom insisted on wrapping cloth around the umbilicus. The cloth was wide, and ended up tucked in the diaper. So when I saw the baby, the healing umbilicus had been wrapped in urine-soaked cloth for at least a day. I unwrapped it, and it smelled like death. It was literally rotting flesh. Despite this rancid finding, the mom still wanted to keep the umbilical stump wrapped. I firmly told her, why not to do that? I don't know whatever happened to that kid, but I never heard about it again, so presumably he and his belly button are fine. Not quite in the same vein as some of these, but during my residency I worked in an area with a very large immigrant community. One of the ways mothers in this particular community relieved fevers for their children was gua sha, which causes severe looking, but generally harmless bruises all over the treated area. For fevers in kids it was usually their backs and stomachs. More than once Child Protective Services was called on parents, usually by new staff who didn't know better, because the marks looked like the kid was being beaten, and more than once parents were investigated for abuse. Luckily, this practice is, generally, not actually harmful to the kid. It also doesn't do anything to help with the fever though, hence why they came to see us in the ER. Not a doctor, but I saw this one episode of 1000 Ways to Die, where this one obese guy wanted to lose weight, and he was looking at a liposuction ad in a magazine. He called them, and was informed of the price of the procedure. It was too expensive for him, so he hung up. He came up with a genius plan as an alternative to liposuction. He called a friend of his over to do him a favor with the alternative liposuction. What happened was I can't remember if he was sitting down or laying down on something, but he told his friend to cut him open and his friend did. I don't know if the blade was even clean at all. Then his friend turned on a big shop vac and tried to pull the fat out of his friend with it. It wound up pulling out some of his intestines or something else and he died. Then after that it was showing a doctor who did liposuction, explaining how the liposuction hose is designed in a specific way and that the suction is at a safe level.